Good evening, everyone, and thank you, Healthcare Asia, for this very relevant and important recognition. On behalf of Viatris Vietnam, I'm very honored to receive this award for Public Partnership Initiative. At Viatris, we believe that lasting public health impact can only happen through strong associations. And in Vietnam, we bring this to life through initiatives such as the Smart Life Cycle Moves in association with the Vietnam Heart Association, reaching over 100,000 users and almost 1 million interactions towards promoting early prevention for better cardiovascular care. This award is for our teams, our partners, and the communities we serve, and we are committed to continue the important work we are doing in the area of public health with patients at the heart of everything that we do. Thank you again.
Rather than simply celebrating Lipitor's 25-year legacy in Vietnam, we used the anniversary to address a much bigger challenge: cardiovascular disease, the leading cause of mortality in the country. Through the Smart Life Cycle Moves campaign, we transformed this milestone into an integrated platform for scientific dialogue, public awareness, and community engagement. We collaborated with more than 80 leading cardiovascular experts and reached over 4,000 healthcare professionals, covering nearly 70% of the national HCP universe, thereby strengthening clinical practice in lipid management and prevention. At the same time, we expanded public awareness through targeted communications and national media engagement, while also engaging communities directly through initiatives such as the 25 years of Steadfast Commitment Run. Together, these efforts shifted the focus from product legacy to long-term prevention, supporting earlier risk awareness and more proactive cardiovascular care across Vietnam. SCORE-VN and SCORE-VNDM2 were created to make cardiovascular risk assessment more accessible in daily clinical practice, especially outside specialist settings. We used internationally validated ESC risk models and adapted them for Vietnamese clinical practice so that doctors could apply evidence-based risk assessment more easily in their own setting. This helped physicians discuss cardiovascular risk in a clearer way with patients, support earlier identification of high-risk individuals, and encourage more proactive treatment decisions. What is particularly meaningful is the level of adoption. The platform has reached a large number of users and visits, showing that there is a real need for practical tools that translate prevention guidelines into everyday care. Our strategy was to connect prevention and treatment within one consistent cardiovascular message. For healthcare professionals, we focused on strengthening scientific education and worked closely with leading experts and partners such as the Vietnam Heart Association. This helped encourage earlier risk assessment and more proactive prevention while reinforcing confidence in evidence-based lipid management, including the role of statins as first-line therapy when treatment is indicated. For the broader community, we combined awareness activities and communication efforts to make heart health relevant before disease becomes visible, encouraging people to act earlier rather than react later. Importantly, we implemented this approach across multiple healthcare touchpoints, from physicians and pharmacists to professional partners, because proactive heart health requires consistent understanding throughout the entire patient journey. This helps create more consistent, prevention-oriented decision-making in daily clinical practice. Winning the Initiative Award for Public-Private Partnership in Vietnam is a strong recognition of the impact that collaboration can bring to public health. This initiative, in partnership with the Vietnam Heart Association, demonstrates how combining scientific expertise, localized innovation, and multi-stakeholder engagement can enhance awareness for a critical national health challenge such as cardiovascular disease. Given cardiovascular disease remains a leading cause of mortality, this recognition highlights the role Viatris Vietnam can play in supporting earlier detection, more proactive prevention, and better patient outcomes. It also reinforces our commitment to continue working closely with stakeholders within the healthcare paradigm through such partnerships for system-level impact, scaling prevention initiatives, embedding risk-based approaches into clinical practice, and improving patient access to care for long-term sustainable progress.